What's going on, everyone? Happy Sunday. Hopefully everyone is doing well, staying safe, healthy, having a great day so far, and hopefully testing negative for the viruses. It is time now for the Sunday edition of the Virus Update for Sunday, August 17th, 2025. If you are new to my channel, welcome to my channel. This is where I do the daily virus update on all those viruses that can make us sick. There's a lot of viruses out there, and you need to be informed of what's going on. Today, our big focus is going to be viruses in wastewater. So sit back, maybe grab a cup of coffee like me, and get ready as I will inform you of what is going on with these viruses. If you're new, subscribe down below, give this video a thumbs up, hit that notification bell, share this video with anyone you know, and of course leave your comments down below. Alrighty, we have just a few news stories today. The main focus will probably actually be wastewater today, though we do have some new numbers from CJS. Starting off with this from Helen Branswell. Would you believe it or not? Flu season, while it may have ended here in the United States, it ended quite some time ago. The number of deaths in children in the United States actually continues to go up. This is a normal thing. It can still go up, but it's just showing how bad the flu season was in the United States. CDC has been advised of another 3 children who died from flu in the 2024-2025 season, bringing the confirmed pediatric death toll to 270. This number could rise further. Pediatric deaths are often reported months later. Most weren't vaccinated. This is beyond tragic, they say. So, yeah, that's not good. And speaking of not good, the back-to-school season. It's just starting. Some schools started last week, maybe the week before. We already have our first potential illness outbreak of the new school year. Yes, it is in southern Illinois. Yes, Heron school sees positive whooping cough case. We all know this is a very contagious virus. This is not a good thing, and they are already alerting parents. As of right now, it doesn't look like the school's going to be closed or anything, but this is the first illness case of the season for back to school. I think I am actually going to be adding this to the section of my site where I have for school issues in relation to illness. I don't know if it's going to make the thread. It'll get in there some way, shape, or form, because who knows, that one case could lead to another case. Japan, this is our final news story today. Can you believe that? Japan, COVID-19 cases up for 8th consecutive week in Japan. Omicron subvariant Nimbus NB.1.8.1 accounts for about 40% of the infections. One of its more notable symptoms is said to be a severe sore throat. We've heard that before. Moving on now. Where do we want to move to next? Let's go to the wastewater viral activity levels in Canada, which is moderate for COVID. Flu A is low, Flu B is low, and RSV is low at this time. Normally, I would sometimes show Ireland and Germany on Sundays. Unfortunately, I checked those 2 countries, and it's the same numbers as it has not updated from the previous week. So, yeah, no update there today. Let's take a look at what's going on with air qualities. Let's refresh this, because I don't think that is up to date. And while we're waiting for that to refresh, let's pause, take a drink of something. Coffee, maybe. Alrighty, taking a look at what is going on here with air qualities in the U.S., and we can see some slight to maybe even near moderate issues in the eastern United States. Nothing severe like we were seeing end of July or beginning of this month, and a few spotty areas in the West Coast where we do see some pretty bad air qualities. Southern California, a couple red sites showing up, even some stronger oranges near LA, and even a few others mixed in. Hey, happy to see Colorado is slightly better. That's a good thing. All right, let's take a look at what's going on with the EMS calls in Pinellas County, Florida, and we can see just a few of them today. And we're not even seeing, actually we are. There's 1 sick person call at this time. Philadelphia has not updated its EMS count yet. It's 10:16 on some Sunday morning. Sometimes it doesn't come in until early afternoon on Sundays. Taking a look at what's going on with Montgomery County, Pennsylvania right now. Just 8 EMS calls at the moment. Taking a look at what's going on with Chester County, Pennsylvania. And, wow, this is busy for 10:17 in the morning. Of course, you're watching this video. It's in the afternoon, but, yeah, take a look at this. That's quite a few calls for a Sunday morning. Did I just see labor? Yes. Congratulations to someone who's having a newborn baby. All right, Bucks County, Pennsylvania. Oh my. Now see, before the video I refreshed it, it said like 2 calls. Now it just suddenly went up to 9 calls, and I'm seeing stroke listed there. I'm seeing several other things. Bucks County, Pennsylvania is having the Grange Fair this weekend. That could be a spreader for COVID, something to watch out for. Just a couple of hospitals in Pennsylvania dealing with issues. 2 that are always yellow in southeast Pennsylvania, and look at that, there's 2 more in the Lehigh Valley. Again, just a few. That's not busy at all. That's fantastic. It is early in the day. I always say early in the day, if you need to use the ER, now is the time to do that. I know several people who have worked in ERs. They all say that. Similar things, that as the day goes on is when it gets busier. Take a look at this. New Jersey, Inspire Medical Center in Mannington. Just 1 issue there, surgical divert, and a psychiatric issue at University Hospital. Alrighty, let's read some data now from CJS. You may notice here we're doing this a little bit different. I usually copy and paste it to a notepad, but for whatever reason, YouTube was auto-blocking his comments sometimes. And it may have been doing it to other people. If it's been doing it to you, send me an email down below to Data Report Live. It's listed down there. It's datareportlive@gmail.com. Is that the email address? I don't even remember. But in lieu of that, I have temporarily, for the time being, this may even be permanent, we'll see, I have set it back to the old way for commenting. I won't have to do any approving unless it automatically hides something. All comments will be out there, and I'll moderate as needed to see if that can hopefully solve that problem, because I'm wondering if anyone else was having their comments suppressed. It's a problem, and it's not a problem that I like to have, because I want our community, I want to be able to read stuff like this. So let's read his numbers for today. First off, Florida reports this is as of Friday's update, 1,532 new cases and 14 new deaths reported today, and 9,471 cases and 67 deaths reported over the past 7 days. That does include that 1 death from 2020, 1 from 2021, 2023, and 2024. To go along with 1,137 CDC reported hospitalizations. That seems to me like a drop in cases, though. Maybe. New York, 774 new cases reported today, and 3,733 cases over the past 7 days, to go along with 340 CDC reported hospitalizations and 4 new deaths. Puerto Rico, 1,006 new cases reported on Friday, 5,643 cases and 11 deaths reported over the past 7 days. All Puerto Rico deaths this week were reported on Wednesday, to go along with 161 CDC reported hospitalizations. Alabama reports, these are all weekly numbers now, 134 CDC reported hospitalizations and 5 deaths reported by the CDC data tracker. California, 7,301 new positive tests, a 23.5% increase over the last week, a test case positivity rate over the past 7 days of reporting of 11.33%, up from 9.97% last week. 1,005 CDC reported hospitalizations and 28 state reported deaths. Georgia, 213 hospitalizations, 9 deaths. Idaho reports 297 emergency department visits. Illinois, test case positivity rate of 4.8%, 132 hospitalizations, and 4 deaths. Louisiana, 1,051 emergency department visits for COVID-like illness, a test case positivity rate of 13%, up from 10.9% last week, a figure that was revised up to 11.5% this week. 130 CDC reported hospitalizations and 4 new deaths. Ohio, 143 CDC reported hospitalizations, a 55% jump from what was reported last week at this time, which was less than 100, and 4 deaths reported by the CDC data tracker. So, Oklahoma this week reports a test case positivity rate of 11.3%. Northeast Oklahoma coming in at 21%. Tulsa County, 16.3%, which was a major decrease from last week when they reported 21.6%, and 2 deaths reported by the CDC data tracker. Pennsylvania continues to rise, 285 CDC reported hospitalizations, more than double what was reported 3 weeks ago, up 24.4% from just last week, and 5 deaths reported by the CDC data tracker. Tennessee, 5 deaths reported. Texas, 4,184 new cases, a 19.44% increase from last week. 756 CDC reported hospitalizations, a 21% jump from last week, and 28 deaths reported by the CDC data tracker. West Virginia, 241 new positive tests. Wisconsin, 244 new positive tests, a test case positivity rate of 6.7%, up from 6.4% last week, and 2 new deaths reported by the CDC data tracker. The CDC reports a national test case positivity rate of 8.9%, up 8.6% from last week. 5,803 nationally reported COVID-related hospitalizations, nearly 900 more than was being shown at this time last week, an increase of 15.35%. And the CDC data tracker added 214 deaths since last week and now shows 1,230,911 total deaths since this all started. He also says it is noteworthy that while they are the 3 most populous states, California, Florida, and Texas combined have 2,898 of the nation's 6,694 CDC reported COVID-related hospitalizations, a whopping 43.29% of the national hospitalization count for this week. Yikes, that is not good whatsoever. Alright, let's take a look at some wastewater for the rest of this video, shall we? COVID-19 wastewater surveillance in Virginia. We do see that there are several areas that are at plateau status, but then we do see in Northeast Virginia, what is this? Little Falls Run, sewer shed. We do see red. That's indicating an increase, and there are some places that are below detection or no trend available, and we don't see anywhere that says decrease, so that's not good. Speaking of a decrease, parts of Orlando, Florida are decreasing. Eastern Orange County and South Orange County are in the decrease at this time, and also Southwest Orange County, which remember last week was continuing to rise. We are seeing Northwest Orange County once again shows a little bit of an increase, and we also see for norovirus in that area it has gone up slightly, and it looks like South Orange County has gone up slightly. So COVID trending better, with exceptions to Northwest Orange County, and well, norovirus is a little bit of an issue there. So that's something we will have to keep an eye on. Going over to the CDC page now, we can see Texas has very high COVID in wastewater. Hawaii has very high COVID in wastewater, as does Alaska, Nevada, and Utah also as well. And then California comes in at high. Louisiana is high. Alabama is high. South Carolina, high. Florida is high. Take a look at this. Connecticut is now listed high as well. Washington State and Oregon also now coming in at a moderate. So they have not reached high status yet. Moderate for Washington, D.C. Michigan at this time is coming in very low, but they do have a shade there of limited coverage. There's multiple places with limited coverage. Oklahoma is another one, also in Indiana. So limited coverage meaning not enough data to give a clear trend of what is going on there. Let's go over to WastewaterSCAN, and we'll take a look at several wastewater sites here. Look in the Northeast. That's listed at high. Look at the Midwest. It's listed at high. The West, the South. Everywhere here is listed at high, and I'm wondering just why is that? Well, you can see here, things continue to trend higher, and there is an upward trend over the last 21 days. Let's start in reverse. Let's go out to the West Coast first. Let's go way west. We'll check Hawaii. What's going on there with wastewater? And oh, wow. So it was showing signs of starting to drop at Sand Island, and take a look. At the end, now this could be incomplete data, but treat it as if it's not. It's going up rather quickly there for COVID. Also take note, norovirus is having a little bit of a trend upward at the moment as well. That's not good. Let's take a look at the other Hawaii wastewater site. And we can see that one is trending upward as well. Since we're going way west like this, let's take a look at Alaska. But before we take a look at Alaska, let's pause again. Have another sip of coffee with me, shall we? That feels much better on the throat. All right, take a look at this. Anchorage, Alaska. It's still listed high. They're saying no trend. I kind of see why. It went up, then it went flat, then it went back down, and it went up a little bit, and then it went down again. But nonetheless, it is still listed high. So treat it as if your risk of catching COVID in that area is higher. Snohomish, Washington. Let's see what's going on there. Hey, good news. Looks like maybe it's going to start trending downward a little bit for COVID there. That is good to see. Let's go south a little bit. Let's take a look. How about Sacramento? I haven't looked at Sacramento in a while. Sacramento for COVID is medium. Overall, you can see this summer they have trended higher. Now maybe starting to trend a little bit lower once again. Las Vegas, what's going on there? Las Vegas, oh my, that went way up and now went downward at the end. Could be one of those wonky movements, incomplete data, something we'd have to keep an eye on. Arizona and or New Mexico. We have to go to the CDC for that. And we can see Arizona is low activity level, and New Mexico is low activity level as well. So that is some good news. But again, there's not some of these states do not have enough wastewater sites. So let's go to Dallas. How about Central Dallas, Texas? What's going on there? Oh my. And now this wastewater site is continuing to trend upward for COVID. Do you have any issues with anything else? Mpox. Look at this. Mpox Clade 2 is showing up in Dallas back in July. Be mindful of that. Let's continue to the east. You know what? New Orleans, southern Mississippi. I'm not even going to click on wastewater sites. Look at this. It's just all still high. There's a couple in Florida that may be starting to trend lower. You know what? Let's go to Tampa Bay for a second. Or Clearwater, I should say. St. Petersburg area. Let's just see. Is this even trending now? It's not. How about this site here? Let's see. This one's starting to trend downward. Okay, but again, wonky movement at the end. The reason why we're checking this area is because it was oh so bad this summer. You could see. Look how high it got at one point. And we're not seeing a continued downward trend. We're seeing a lot of bouncing around there. Let's go up to the Midwest. Let's see what's going on in Warren, Michigan. In Warren, Michigan, things are starting to trend a little bit higher. That's not good for COVID. How about what's going on in Akron, Ohio? Let's take a look there. Akron, Ohio. You're starting to trend slightly higher. Let's go somewhere where COVID appears to be. How about Wheeling, West Virginia? It's coming up low there. Let's see. It is. So you're not doing bad right now in Wheeling, West Virginia. Let's see here. Let's go up to northwest of Chicago, Glen Elwyn. And COVID is listed at medium. Do we still have a detection of Mpox? Or was that the other wastewater site? Maybe that was Wheaton. I think it was Wheaton. Let's take a look there. COVID is listed low there. And it's up ever so slightly. EVD 6.8 virus. Uneducated about that one, but it is coming up high for you. Mpox, multiple detections at this time. And also, let's go back to Michigan for a second. Traverse City, Michigan. Not only is your COVID listed at medium, we still have that issue with measles. Look at all these measles detection. There's clearly community spread going on there. I think they have had more cases than we know about. Someone's just opting to not seek health care. All right, going over to the northeast, let's take a look at Portland, Maine. You can see Portland, Maine at this time, slightly higher when it comes to COVID. Everything else is doing fine at this time. Let's continue our way southward. Dover, New Hampshire. What's going on there? Let's take a look. And oh my, wow, look at COVID there. It's a pretty big turn upward, and then it's gone down a little bit. So COVID is high in your area. And look at that. We have an Mpox detection. We're seeing a lot of Mpox detections this summer. That, my friends, is not good. Taking a look at Bridgewater, New Jersey. Over in Bridgewater, New Jersey, yeah, COVID's starting to trend up there once again. Hepatitis A was detected back in June. And continuing on here, let's take a look at Southeast Pennsylvania. Chester, Pennsylvania. I hope we get the Pennsylvania State Dashboard update this week. Take a look at this. It has actually gone downward. Again, some wonky movements. That could get corrected. Still listed at medium for COVID. Everything else is fine. Some earlier summer hepatitis detections there. Seaford, Delaware. Not liking this. I'm seeing it listed high for COVID. Let's see what's going on. It is trending upward there, and everything else is fine at this time. We will do one more wastewater site. And where is that going to be? How about Maryland? Hagerstown, Maryland. Let's take a look at what's going on there. And we do see COVID is listed at high at this time, and it is continuing to rise. Everything else is fine. Alrighty, folks. That does it for the Sunday edition of the Virus Update. If you enjoyed today's update, give it a thumbs up. Let me know if you like this new little twist where we do coffee and wastewater on Sunday, or whatever you want to call this, the Sunday Virus Update. Hey, if you're new, subscribe down below, hit that notification bell, share this video with anyone you know, and of course, leave your comments down below. Ways to support the channel, such as becoming a Patreon member, a channel member, or any other way is listed in the description down below. I will see everyone again tomorrow. Until I see you again tomorrow, have a fantastic day, but stay safe, everyone. Take care. Thanks for watching.